Good day, everyone. Thank you for joining us on this webinar. We're very happy that you are with us today. We're going to talk about a very important subject. We have a special guest with us today. Her name is Stefanie Beniek, and she is with the Penny George Institute in Minneapolis, Minnesota. We're very happy that she's joined us. Before we get started, and before Stefanie comes on with us, we want to talk about just a little bit about many of the rumors that are flying around in this profession about fertility, birthing, labor, and various other things. AAC does cover you through labor. There are certain things that have to be done and questions you have to answer, but it does do that. So, good morning, Stefanie. We're happy that you're with us. And I'd like you first just to chat a little bit about what you do, where you do it, some of the rules and regulations you have to deal with, and just generally introduce yourself. Yes. And again, thank you for joining us with this very important subject.
Yes, thank you, Marilyn, for having me on. Well, my name is Stefanie, and I'm a licensed acupuncturist. I work with the Penny George Institute for Health and Healing. They're my parent department within Allina Hospitals and Clinics. I work up at Mercy Hospital in their mother-baby center, and I work with patients in labor and delivery and postpartum care, and a few patients in antepartum care, but we don't get very many of them. It's a smaller hospital. We have 13 labor and delivery rooms, and then we have 27 postpartum rooms. And I work on both floors. There's also a massage therapist that's in our department, so we switch back and forth between days, whether there's a massage therapist on or myself, the acupuncturist. And I also own and run my own private practice in Minneapolis called Family Tree Acupuncture. And I've been doing that since I got out of school in 2009 and have been specializing in pregnancy and fertility pretty much from the very beginning. I was an intern at the Penny George Institute for Health and Healing in their inpatient department. And I went in there saying, I want to specialize in maternity care. That's all I really want to do. And they said, okay, you can be with Zena Coker, who is a fabulous acupuncturist, and she's been with the Penny George for, I think, 12 years now. And that's kind of how I got my start in understanding hospital regulations and how to work in a hospital, being an acupuncturist. Went out and did my private practice for a while, and then about a year and a half ago, this position opened up with Allina in their mother-baby centers. And I thought, well, I have always wanted to work inpatient, and that's what that's kind of been my dream job. So I'm continuing to do my private practice and work at the hospital at the same time.
Well, congratulations. Yeah. I think That's a great story.
Yeah. So you asked some questions about regulations in the hospital and just in labor in general, because before I was in the hospital, I did do on-call labor work with some of our freestanding birth centers. We're lucky enough in the Twin Cities area to have 4 freestanding birth centers. And then it might be 5 now. And then we have a very large home birth community. So because I was not an employee of a hospital before, and I wasn't credentialed in a hospital, I primarily worked with the home birth community and freestanding birth centers. And kind of the rules and regulations around all of that was similar to, working and doing a home visit with people, getting informed consent and making sure they were under the care of a licensed or certified nurse midwife or licensed home birth midwife, never going in and being the primary care person myself, just going in when they need a little extra help in labor. And now working in the hospital, in order to do acupuncture, I have to have the OB sign off on the order, and then get informed consent and have them sign the informed consent, as well as having the OB okay the acupuncture order. Now, with that said, I can do non-needling techniques. So I can do a lot of acupressure and tuina and acupressure press pellets without the OB sign off on it, because it's a non-invasive technique. It's not breaking the skin barrier. So, but I do have to get an order just to even go in and do that on a patient.
Is it difficult to get an order from an OB? And approximately how many of them do you work with, and how did you build those relationships?
Yeah, so it's not very hard to get an order from the OB now that I've built the relationships there. In the beginning, they were, I came in kind of saying, well, this is what acupuncture can do in labor. And they were like, whoa, hold up a little bit. Like, let's get to know you first. And so in building the relationships with them over the last year and a half, they all are just kind of like, yeah, it's Stefanie, go do acupuncture. Yes, of course I'm okay with her doing acupuncture on my patient. And I work with, let's see, it's 2 really large groups that work there. And then there's a smaller group of family practice doctors that work at the hospital. And I'm just estimating, I don't know the numbers specifically, but I think there's between 15 to 20 OBs in each of those large groups. So there's quite a few. I would say maybe like 40 to 50 OBs that I have worked with over the last year and a half. And yeah, so it's not difficult for me to get an order now. And because they know me, and we've had lots and lots of conversations at the nurses station, and I've gone to their meetings and showed them the research on acupuncture and labor and delivery, and kind of talk their language, and and so they trust me with their patients now.
I like the word trust. I think that's probably the most important word that you can talk about when it comes to getting a referral, is do they trust you and they know you? Thank you very much.
Mm-hmm.
So tell us a little bit about, how does acupuncture help during labor, and maybe some specifics with what you do with a laboring patient.
Yeah, so at the hospital, I generally have to kind of talk a little bit of a different language. I've been so used to talking in my TCM language for many, many years, but they don't understand that there. So when I talk about what acupuncture does in labor, I try to stick with what the research shows and what we know in a Western medical way, because I feel like that is best received by the other medical professionals that I work with, and with patients too. They really seem to understand that. So acupuncture really works well to help open the pelvis, relax the pelvic floor muscles. I work a lot on the sacrum, which has a lot of nerves that come off of the sacrum and innervate the uterus, and that helps to stimulate contractions. It also works to just decrease stress and anxiety. I can work on lowering blood pressure and decreasing headaches or nausea. The other kind of mechanical things and Western medical things that happen in the body when you get acupuncture in labor is it does release endorphins and natural oxytocin in your body. So that in and of itself helps to stimulate contractions. And then some studies have suggested that it does release prostaglandins, which helps to soften the cervix, soften and ripen the cervix.
Very interesting.
Yeah. Yeah.
Where did you find all of your research that you're able to use?
We have a wonderful librarian at Alina Health who has helped me to look up lots of articles on labor and delivery and pregnancy and postpartum care and acupuncture. And then I also do my own searches on PubMed, is kind of my primary go-to if I'm really looking at like, well, okay, I heard that acupuncture, I read in some article that acupuncture might release prostaglandins. Well, I go to PubMed and then type in prostaglandins acupuncture or labor and delivery prostaglandins. And then by keeping up with the research and the articles that are coming out there, it helps me to be able to better talk to the OBs in my clinic or in the hospital setting, and the nurses too.
So it sounds to me like you work at this, keeping on the cutting edge of what's going on and communicating on a regular basis. How
Yes.
often would you say that you communicate with either one? Do you ever do group in service with them? And how do they respond to that?
So I communicate with the OBs and the nurses every day at the hospital, and I'm there sometimes 2 days a week and sometimes 4 days a week. It just depends on my shifts. And yeah, I'm just communicating with them constantly when I'm there. And then in terms of in a group setting, it's generally maybe every 4 to 6 months that I'll go to one of their meetings and just kind of pop in and talk to them a little bit more, give, a little 2 to 5 minute reintro of myself, or talk about if there's any new research that's come out or new articles that have come my way, and I want to talk to them about it. We also have just started putting out a newsletter, and we send it out to all the nurses and all the staff and all the OBs within the Mother Baby Center, just at our hospital. So that's a good way to communicate with them as well. And in that newsletter, we tend to include just little tips about things that are going on in the hospital, in our department, or the last session or the last newsletter, we included a whole bunch of research that we had recently come across. And then in their next OB meeting, they grabbed that newsletter and then went over and looked at all of that research. And then it's nice because then they look at all of that, and then we can go and talk about it when I see them at the nurses station and the labor and delivery unit. So
sounds to me like you're an integral part of the hospital and what's going on. I think that's a wonderful position to be in, and congratulations for being.
Yeah, it's been really, really great. We've really integrated. I feel like myself and the massage therapist that's there, we've really integrated pretty well into the unit, which was the hope of Penny George, in putting us, just a couple of us, at one specific unit. Yeah.
Very good.
So
How well
sorry, I
let's
skipped around a little bit.
and talk about how can an acupuncturist who wants to do this, wants to get into a hospital, wants to work, how do they connect it to begin with either the birth community or a birthing center or a hospital? What do you think would be the beginning steps?
Well, I think the beginning steps is just networking. I mean, if you're a good networker, as owning your own business as an acupuncturist, you're going to do just fine in connecting with these people. One thing that I have found that's been really helpful is setting up a meeting with, or if you're looking at birth centers, setting up meetings with the midwives and going in and talking to them. And it doesn't have to be long, just 15, 20 minutes of going in and introducing yourself to them and talking to them about how acupuncture can be beneficial during pregnancy and labor. And one thing that I found very useful is I gave them little 20% off vouchers for patients if they wanted to try out acupuncture that they could use in my clinic. And then I also gave them little prescription pads so that on the prescription pad, it had my clinic information, and then they could just go through and check off why they wanted the patient to come and get acupuncture. And that was helpful for the patient, because then they would be able to use the voucher and then use the little prescription pad to come to the clinic and be like, okay, well, my midwife wants me to come and do this. And then that also helped me to connect with birth centers, so that if they were interested in, or if their patients were interested in having me come during their labor, they knew who to call. They had someone, again, who they trusted and they had confidence in to call to help take care of their patient during labor. Now I say help take care of them, and that's meaning I go in and I give them acupuncture and I stay for maybe an hour to 2 hours, and then I leave because they're under the care of the midwife. Now, as far as if you have a home birth community in your city, Just going, I'm sure there's home birth midwife groups that you can get connected with. Getting connected with doula organizations have been really helpful for getting me referrals. And then in terms of getting connected with the hospitals, that's a little bit more challenging because there is this whole issue of you can't just go into the hospital and just do acupuncture on anyone. You have to be credentialed in that hospital, and and that is a barrier. So you can go in and do non-needling techniques. So not bringing your acupuncture needles, not bringing anything that is breaking the skin barrier. But you also have to make sure when you do that, that it's okay with everybody on that patient's care team. So it's okay if they have an OB or a certified nurse midwife, that it's okay with their provider, and it's okay with the nurse that's taking care of them. Everybody in their care team, that it's okay with them that you're coming in and helping out this patient in labor. So before I was at Allina Health and credentialed at Mercy Hospital, I would go to hospitals, but I wouldn't use my needles. So I would use my hands and not break the skin barrier, and then always make sure that it was okay with everybody, their whole care team and their providers, that I was there and that I was doing that. And I had formed some really good relationships with some of the nurse midwives at a couple of the different area hospitals. So again, they knew me and they trusted me that, oh, if this patient wants Stefanie to come in and do some acupressure and Tuina on them during labor and delivery, that's totally fine with us. So yeah.
So you said something about a referral pad. How did you figure out to put together a referral pad to give to the referring physician? It is your referral pad and they send the...
Yep. It might have been from you.
Oh.
You taught a seminar and practice management at Northwestern Health Sciences University.
I remember doing that. Okay.
And it was right when I got out of school. I think it was like in 2010 or something. It was like I had been in practice for maybe a year or two. And I thought it was around the same time. Maybe it was you that recommended that. And then the other thing that I started doing after I took your seminar too, and that was that I would find out the doctor or the OB or the nurse midwife of my patient if they were coming to me prenatally, and then just send them a little thank you card with either the prescription pad in or the 20% off voucher. And I wouldn't mention the patient's name at all because, that would break HIPAA unless they had signed a release of information. But I would send out a little card that just said, I appreciate being able to share in the care of your patients. Is that word for word from your seminar?
Thanks.
And the thing is it worked. It worked really, really well. And people started understanding that I was sharing in the care of their patient. I was not trying to be their primary care person, which I think, from my experience, I think some OBs and nurse midwives, get a little hesitant about acupuncturists or other medical professionals, that they're going to somehow think that they're taking on the primary care role for their patient when they're supposed to be the primary caregiver. So I think that line of sharing in the care of your patient was helpful. So,
have you found it easier since you've been in practice to begin to meet a new medical provider and to work with them? Do you feel the level of trust has gone up, and are you seeing more patients?
I would say that over the years, I feel like the level of trust has gone up just in general in the Western medical field for acupuncturists. I feel like in the beginning, when I first started practice, people really just didn't know what acupuncturists did, and there's still a lot of that. But I also do feel like, the more I'm around and the more people hear my name and know my name, I mean, the birth community is very large in the Twin Cities, but in some ways it's very small because everyone talks and everyone knows each other. And so I know the other acupuncturists who specialize in pregnancy and labor and delivery too, and I know who's willing to go to labors and who's not, and or who's generally available. And you know, and the home birth midwives and the birth center midwives and the OBs, they all talk to each other. So they start to know who's who in the acupuncture world too.
That's
Yeah.
that's a very good point. People
Yeah.
do talk, yes.
Yeah.
When do you think that a patient support or a support system or a nurse would begin to ask about acupuncture support during labor? Is there like a specific time frame, or does it just come up as people begin to know, that kind of thing?
So I think there's a couple of different ways. You know, sometimes it's someone who's getting acupuncture prenatally and they know they love acupuncture and they want it during their labor, you know, and they generally have that in their mind or have that in their birth plan. But if they're totally new to acupuncture and it's just their care provider suggesting acupuncture, generally the criteria are, or what I tell people to call me for is if they're being induced, if they're having a Western medical induction. That's a fantastic time to get acupuncture because it does help to shorten the duration of the induction. And some studies have suggested that it does tend to decrease C-section rates, but that's, you know, just some studies. And but if they're having a really long, prolonged labor, you know, they're just really taking a really long time to dilate, even if they have an epidural and they're comfortable with their epidural, but, you know, they're stuck at 4 centimeters and they've been stuck there for a really long time, it's definitely worth having the acupuncturist come in and see if they can get that patient to dilate a little bit more. If they're having back labor or if there's a posterior position baby or asynclitic baby that's either confirmed or suspected by the provider, that's an excellent time to have an acupuncturist come in. If there's a lot of, you know, if the patient's just not coping well with the labor anymore, whether they have an epidural or they are having an all-natural birth or they're just really early on in their labor, anytime a patient's not coping well with their labor, it's a great time to have the acupuncturist come in because we can do stuff to help them decrease their pain and make them feel a little bit more comfortable with their contractions. We might change where they're feeling their contractions, and that can help them cope a little bit better with the labor. Now, I just want to make a little note. I did mention, you know, acupuncture working well for asynclitic babies. That's kind of like crooked babies, heads not coming straight down, or posterior babies. And what I'm doing with that is I'm not turning the baby. I'm not physically moving anything with the baby or in the belly. What I'm doing is I'm creating optimal conditions in the mom's body so that the baby can turn on its own, if there's space for that. So I'm just kind of working with the pelvis and the sacrum and the pelvic floor to help open that up and create a better condition in that mom's body so the baby can get into a better position.
Okay. I know that we've been talking just basically about labor and delivery. Do you do anything with infertility or fertility issues? Is that something that you have gone into, or is that a totally different section of what we're talking about?
No, I actually, I started off my practice just saying I just wanted to specialize in pregnancy and labor and delivery. But then what happened with that is then I started to get fertility patients. So now my outpatient clinic is primarily, I would say like 80 to 85% fertility patients. And then they stay with me throughout their pregnancy. And then I'm not on call for my patients anymore for labor and delivery because I work at the hospital. But there also is let's see, three to four hospitals in the Twin Cities now that offer acupuncture and massage during labor. So I just advise them to go to one of those hospitals if they want acupuncture.
Well, I think that's great. It sounds to me like acupuncture has moved quite well into this area.
Yes.
But I think you also have to have some kind of special training in it.
Absolutely.
And you give us some idea where you can get more training in labor and delivery, probably after that you graduate from school, if that's something that they're interested in.
Yep. So the best place to get training for acupuncture, labor and delivery is, it's great to do it hands-on, because labor and delivery is, you have to be so hands-on with the patient. You can't, it's very rare that I just go in and put in needles and then don't really touch the patient much after that. So I am offering a 2-day seminar this June with Claudia Sikovitz. She is one of the leading acupuncturists in labor and delivery from out in New York, and she has developed a class called Birth Basics, and we are going to be co-teaching that class together this summer in Minneapolis. And I believe Alan is going to send out a link after this to the email list with how to be able to register for this class, because you can register through my website. The other thing is that Claudia does offer this class online through a Pro-D seminar, and actually doing training in the Pro-D seminars, they do have quite a lot of online recorded and live seminars in the pregnancy realm on Pro-D. And then the other thing is, like, you know, if you're kind of like, you know, you've done some of those and you want to just you haven't necessarily been to a birth yet, and you want to know what that's like, because that's really important to be able to have gone to a birth first and experienced what that's like before you go and you try to be a provider for someone at a birth. So my best suggestion is, if there's lots of doula trainings around in pretty much every city, and it's just generally a weekend seminar. So if you go and get a doula training, you get a lot, not that you're going to go become a doula, but you learn a lot more about the whole childbirth experience and the different phases of the labor. And then it also helps you to get connected with some area doulas for cross referrals. And then sometimes, you know, you can ask one of the doulas, like, hey, could I come and shadow you during a birth? Or if you have a good relationship with a midwife, you could also ask that. Ask them if you could come and shadow them, and just get a feel for what a birth is like from start to finish. And then you could kind of better know where you could help out.
Okay. I want to go back and touch just a little bit about credentialing in a hospital.
Mm-hmm.
Can you just share with us a little bit of the process that you went through? Was it difficult? Was it easy? Was it free? Did it cost?
Mm-hmm.
That type of thing.
So at my hospital, it didn't actually take too long, because we don't bill insurance. We don't bill the patients for acupuncture during labor. Myself and the massage therapist are wrapped into the budget of the cost center of the mother baby center. So that's where our paychecks come from. We don't bill the patient's insurance. So I didn't have to be credentialed with the insurance company. So that shortened up my time quite a bit. But it did still take about, I think it was about 6 to 8 weeks to get credentialed in the hospital. And I just had to provide them with documentation of my license and my board exams, like that I had a Minnesota license and that I was NCCOM certified. And then I had to have basic life support as well. So just showing my licensure.
All right.
Yeah.
And when you did get credentialed, did you have any interviews that you had to go through, or this was all paper screenings?
It was all paper screenings, yeah. And it might be different at different hospitals, because I know some hospitals do charge patients for acupuncture and some don't, and some it's all wrapped up with education and through a university. But no, Alina was pretty seamless in that respect. I just had to answer a bunch of emails.
Okay. And did you answer them timely?
Yes, that was really, really important. I really had to be on top of it and answer them basically the same day they came in. And if I was not answering them that same day within business hours, by 5 p.m., then they would send me quite another email, or I'd get a phone call and it'd be like, we really need to move this through. So I think there was only one that I missed, and then I never missed another one.
A lesson learned, right?
Yeah, yeah.
Okay. Do you have anything else you'd like to tell us about this process? It's been very educational. I want to thank you for your time, but is there anything else you'd like to add to tell us? And can people contact you some way?
Yes, yeah, people can definitely contact me. I'm more than happy to answer questions and, give advice if people are really trying to get into their hospitals. I can try to put you in touch with some people at Penny George if you're really wanting to develop a integrative medicine department, and kind of just give you my experience. I think the best advice that I have for people is just, if you want to do acupuncture in labor and delivery, you have to figure out first in what capacity you want to do that. Do you want to be on call for just kind of anybody at birth centers and home births and hospitals, or do you want to try to get a department going in one of your area hospitals? And that's a pretty big project, but I don't think it's undoable. I think it's very reasonable, especially since there are lots of acupuncturists popping up in hospitals across the country. It's very, a lot of people want that in their hospital, and it increases patient satisfaction. So that's one thing you got to talk to the administration about, is that it increases their patient satisfaction.
And I think that's something that almost everybody's beginning to look at. Acupuncture is becoming fast growing, both in the United States as well as around the world.
Mm-hmm.
It's just one more area that can be touched and helped patients. We call it patient-centered care. And I want to thank you very much. I think this was a great chat. And I'd like to also say that if there's something else that you listening to us want to know, please let us know, because we're looking for information to get out to the profession, to help this profession grow, become more professional, and take our place in the healthcare system.
Well, thank you, Marilyn.
Thanks, Stefanie. Have a great day.
You too.
I'd like to thank you for joining us today. I hope that you found this interesting. The American Acupuncture Council has been working for a long time, almost 30 years, to try and improve things in the acupuncture field, and we're taking it one step further because acupuncture is such a growing field. We want to support it. We're also making some changes and upgrades to the policy because things are changing in this world. And I can remember when acupuncturists didn't work in hospitals. And look, as she said, acupuncturists in hospitals are popping up all over the United States. More and more people are looking toward the acupuncture profession to help. And I'm grateful to see that this profession is beginning to integrate into the healthcare system. One of the reasons I've worked so hard on getting the acupuncture codes for this profession is because I believe that the citizens of this country should have the opportunity to have acupuncture in their healthcare. And I want to thank you for your help in moving this forward. I hope that you'll join us every month when we bring you a different guest on another subject. And if you have questions or you have comments, or there's something you'd like to hear us talk about in this program, you can call 800-838-0383 and talk to Lewis or myself about what you'd like to see and how you'd like us to help more in this profession. Thanks again, and I hope you all have a great day.